The Hantavirus outbreak, emerging risks and global response. Welcome back to Medical Facts Today. While we often focus on chronic health trends, today we must address an urgent and evolving situation: the current multi-country outbreak of hantavirus linked to international travel. This outbreak has triggered a global alert, involving health authorities from over 12 countries, including the UK, the Netherlands, and South Africa. As with all our episodes, this information is for educational purposes only. If you suspect exposure or feel unwell after traveling, contact a healthcare professional immediately. What is hantavirus? Hantaviruses are a family of viruses primarily spread by rodents, such as mice and rats. Humans typically become infected by breathing in air contaminated with the virus from rodent droppings, urine, or saliva, a process known as aerosolization. While these infections are generally rare, they can cause two severe clinical syndromes: hantavirus pulmonary syndrome, HPS, which affects the lungs, and hemorrhagic fever with renal syndrome, HFRS, which targets the kidneys. The current 2026 situation. The current alert centers on a cluster of cases identified in early May 2026 among passengers on a South Atlantic cruise ship. As of May 8, 2026, 8 cases have been reported, with a high case fatality rate of 38%. Laboratory testing has confirmed the Andes strain, ANDV, as the cause, which is particularly notable because it is the only hantavirus strain known to occasionally spread through direct person-to-person contact. This unique characteristic is why international contact tracing has been so aggressive for those who were aboard the vessel or its subsequent medical evacuation flights. How the virus affects the body. Once the virus is inhaled, it targets the endothelial cells, the lining of your blood vessels. Capillary leak. The virus causes tiny blood vessels in the lungs to become leaky, leading to pulmonary edema, where the lungs fill with fluid. Respiratory distress. This rapid fluid buildup makes breathing extremely difficult and can lead to acute respiratory distress syndrome, ARDS. In severe cases, patients may experience cardiogenic shock, where the heart cannot pump enough blood to the rest of the body, leading to multi-organ failure. Symptoms to watch. The symptoms usually appear within 1 to 8 weeks after exposure and often begin in 2 distinct stages. The early stage. This phase mimics the flu, with high fever, muscle aches, especially in the thighs and back, fatigue, and gastrointestinal issues like vomiting or diarrhea. The critical stage. About 4 to 10 days later, the symptoms escalate to a dry cough, severe shortness of breath, and chest tightness. Prevention and treatment. Currently, there is no specific antiviral treatment or vaccine for the Andes strain of hantavirus. Early supportive care. Survival depends on early hospitalization and intensive care, which may include mechanical ventilation or ECMO to support the heart and lungs. Protective measures. If you are in areas with rodent activity, avoid stirring up dust. Use a disinfectant spray on any droppings before cleaning, and always wear gloves and a mask. In healthcare settings, patients with the Andes strain require strict airborne isolation precautions to prevent secondary transmission. Staying informed is the first step in public health safety. If you found this update helpful, please like, subscribe, and share this video to help spread awareness of this current health situation. Stay safe, and we will see you in the next update.